This is about polio or poliomyelitis infection. Let's refresh our memories. I am Dr. Nadeem Sajjad Raja. Poliomyelitis or polio is a highly infectious viral disease that largely affects children under the age of 5 years. The mode of transmission of this viral infection is person to person, mainly through the fecal oral route, or in some cases by a common vehicle, for example, contaminated water or food. Poliovirus lives in the throat and intestines. It multiplies in the intestines, from where it can invade the nervous system and cause paralysis, which is really severe form of this disease. The virus can live in an infected person's intestine for many weeks. It can contaminate food and water in unsanitary conditions. Wild poliovirus cases have decreased by over 99% since 1998, from an estimated 350,000 cases in more than 125 endemic countries to 6 reported cases in 2021 of the 3 strains of wild poliovirus, type 1, type 2, and type 3. Wild poliovirus type 2 was eradicated in 1999, and wild poliovirus type 3 was eradicated in 2020. As at 2022, endemic wild poliovirus type 1 remains in 2 countries, Pakistan and Afghanistan. So what are the signs and symptoms of polio or poliomyelitis virus infection? Up to 90% of those who are infected experience no or mild symptoms, and the disease usually goes unrecognized or unnoticed. About 1 out of 4 people, or 25 out of 100 with poliovirus infection, will have a flu-like symptoms that can include sore throat, fever, tiredness, nausea, headache, stomach ache. These symptoms usually last from 2 to 5 days, then go away on their own. A small proportion of people with poliovirus infection will develop other or more serious forms of disease that affect the brain and spinal cord. For example, meningitis, paralysis. Poliovirus can occur as rapidly as within a few hours of infection. Of those paralyzed, 5 to 10% die when their breathing muscles become immobilized. The virus is shed by infected people, usually children, through feces, where it can spread quickly, especially in areas with poor hygiene and poor sanitation. So how we can diagnose? So healthcare providers who suspect a patient has a poliovirus infection should hospitalize the patient right away. Do a physical examination, take detailed medical history, including vaccination history and history of any recent travel. Collect samples from stool, throat swab, blood, urine, and spinal fluid, and obtain a magnetic resonance imaging, MRI, to look at the pictures of the spinal cord. Poliovirus is most likely to be detected in stool specimens. So how we can treat this infection? There is no specific cure for paralytic polio and no specific treatment. Physical or occupational therapy can help with arm or leg weakness caused by poliovirus and might improve long-term outcomes, especially if implemented early in the course of illness. Healthcare providers should consider consulting neurology and get their opinion and infectious diseases experts to discuss possible treatments and recommend certain interventions on a case-by-case basis. If you think you or someone in your family has symptoms of poliovirus infection, please call your healthcare provider straight away without any delay, or go to an emergency room. So how we can prevent this infection? The polio vaccine given multiple times can protect a child for life. More than 20 million people are able to walk today who would otherwise have been paralyzed since 1988, when the global polio eradication initiative was launched. An estimated 1.5 million childhood deaths have been prevented since then through the systemic administration of vitamin during polio immunization activities. Vaccination is crucial in the fight against polio. Failure to implement strategic approaches leads to ongoing transmission of the virus. Endemic transmission of wild poliovirus is continuing to cause cases in border areas of Afghanistan as well as in Pakistan. Failure to stop polio in these last remaining areas could result in as many as 200,000 new cases every year within 10 years all over the world. That is why it is critical to ensure polio is eradicated completely once and for all. Thank you very much for watching this video.